All right. Hello, everybody. Thanks for joining us tonight on the Integrative Nurse Coach Gathering. I am Carly Mertz, board certified nurse coach and Inca's nurse planner, and I am here with my co-host, Lisa Osler.
Hello, everybody. Welcome. It's really great to have you here, and we have a really exciting webinar for you this evening. So just a little kind of intro. My name is Lisa Osler. I am a board certified nurse coach and one of the faculty members at INCA, as well as the creator and instructor for Yoga for Nurses. And I am really excited to invite Christy to our webinar this evening. We've been really excited about this. So thank you so much, Christy. Christy is a board certified hypnotist, board certified nurse coach, CRNA, and trainer of neuro-linguistic programming, timeline therapy, and hypnosis. With decades of experience in the healthcare industry, Christy has spent much of her career using hypnotic tools to help people when they need them most. She founded Enter Into Calm, a company that serves patients who want more control over their own healing journey. Christy is also the creator of the Hypnosis for Nurses course offered by the Integrative Nurse Coach Academy. She is dedicated to helping others achieve a sense of calm and control in their lives, and her clients rave about the positive impact her work has had on them. Whether you are dealing with stress, chronic pain, or looking to improve your communication skills, Christy has the tools to help you achieve your goals. I'm signing up. So welcome, Christy.
Thank you, Lisa. That was a great intro. I was like, wow, who are they describing there? Thank you.
All right. So thank you, Lisa, for that lovely intro. So Christy, we've all heard of hypnosis, but we might not really understand what it is. So can you briefly describe that for us?
Yeah, and I think first we're going to call on our colleague Lisa to put that poll up because I am curious for those watching, whether live or the replay, who has experienced hypnosis and who has not, right? Because yeah, we've all heard about it. And as I start to describe it, you may start to realize something different than your first initial answer. Or you may have an experience where you did experience formal hypnosis, or you may have been in college and had a stage hypnosis experience, right? So I am always curious to start with that question. So what is hypnosis? The simple answer is there's far more definitions of hypnosis than there are hypnotists. So what I can tell you is that what we've settled on as the National Guild of Hypnotists and the Clinical Hypnotherapist of a definition that says it is a state of consciousness, right? And yet the person experiencing hypnosis may look like they have their eyes closed and are resting or are deeply asleep. But it's a state of consciousness. It's a state where we are focusing our attention. It's an active brain state. We know this now because we hook people up to functional MRI and the EEG. We know that it is an active brain state. And it also, the third component that makes it hypnotic is what we call hypersuggestibility, or the ability to suspend disbelief, to expand our current thought model, or to maybe even soften that inner saboteur, okay? So it's a state of consciousness, it's a state of focused attention, and it's a state of mind where we can have suggestions come in. And it's often, I like to describe it as the bridge between our conscious mind and our unconscious mind. So there is a metaphor that was offered by Sigmund Freud. And he says that our mind is like an iceberg. Maybe some of the audience has heard this metaphor before. The tip of the iceberg, he says, is your conscious mind. So 1/6 of that whole iceberg is the tip. And that's 1/6 of our mind. The 5/6 below, the 85% that's below the water surface is our unconscious mind. So our mind is this big iceberg. And so hypnosis is the connection between our logical thinking mind and then what's below that, our unconscious mind, our thoughts, our feelings, everything that's happened to us, everything that we've learned before, all our beliefs and values.
Yeah. Awesome. That was a great explanation. Thank you. So that leads me to my next thought is people might have heard a lot of misconceptions around hypnosis. Can you share some of those with us?
Yeah, and I bet you can even think of some of the misconceptions you have yourself, right?
Yes.
So a thought that hypnosis, you have to be out. It looks like somebody's unconscious, knowing that I just said hypnosis can happen in an awake state, right? Mm-hmm. People often think too that hypnosis is mind control, right? But it's your mind that you're controlling. You can choose. Now things are more open to you and expansive, right? There's no losing control with hypnosis because you're in this active brain state. Another misconception is people can get stuck in hypnosis. So think of other times when you've been really focused on something, like a good book, right? A good book, you're really focused on it. And you might even have somebody come into the room and they ask you a question and you answer them. Mm-hmm, yep, I'm cooking dinner tonight. By the way, they heard you. But you're in the book and you're like, oh, did you ask me about dinner? Right? So we are really focused on something, really absorbed into it. And even things have happened in our surroundings and we've answered to it, but we're still really focused. So can you imagine though, getting stuck in a book, like literally stuck, like I can't stop reading? Well, maybe temporarily, yeah, but you're making a choice. So people think, well, I'm going to get maybe stuck in hypnosis. No, you'll make the decision to come back as soon as you're done processing, as soon as that chapter is done, right? So it's not mind control because you're focused, you're in control of your mind. It's not losing control because again, you're active and you can't get stuck in it. And you're not asleep. You're not asleep because it's a state of consciousness. So I think those are the biggest misconceptions, but we also have that misconception around stage hypnosis, right? We don't quite understand how can hypnosis be healing if it's also used for entertainment in our colleges, right?
Yes, I actually went to one in college. Yeah. I remember. Yes.
And I think that, and then also how can we use this thing called hypnosis when there's movies about hypnosis and it's kind of this mind control and somebody controlling somebody else. And that doesn't, so yes, stage hypnosis happens and yes, people have an experience there. Yeah. But those people who go up on stage, they want to do that for entertainment, right? The stage hypnotist might have 20 people come up and at the end of the performance, there's only 4 or 5 that are still kind of playing along. And we all have that kind of sense of fun and excitement, right? So I think that creates some misconceptions around hypnosis. But what I like to reassure people is that hypnosis and meditation are pretty similar. And we know that we can all appreciate meditation, right? Especially in the nurse coaching realm. We center ourselves, we ground ourselves. Meditation is softening the mind, quieting the mind. Hypnosis often will start with that same concept, and then hypnosis comes and starts to change the mind, right? We're telling the mind, I don't want you to go this way anymore because I have a habit or I have a belief that I need to change. Not this way, mind. I want you to go that way. Not this way. We're going to start going that way, right? Smoking cessation. I was a smoker and now I'm a non-smoker, right? So that's how we kind of just are reprogramming, right? Or maybe resetting. I like to say creating a new pathway, right? We're very used to going this way and now we're going to change and go that way, right? And we can all change. So hypnosis helps to quiet the mind. So when we're trying to go change directions and our mind's like this way, and you have all the reasons, see, you can't go the other way because you're not good enough. You can't go the other way because you're not worthy. You can't go the other way because whatever reason pops into our head, our conscious mind. And we have to say, nope, we can, and we're going to go that way, right? So that's where hypnosis starts to create change.
Yes, what a powerful, positive impact that this could have for so many people. And in our healthcare setting too, as well. Do you see this being used in healthcare in the future, or is it being used in healthcare today?
Absolutely. So, I mean, I learned about hypnosis very shortly after I finished my anesthesiology residency, and I've been using hypnotic
Okay.
language again and again and over with patients going in the operating room and coming out in recovery and pain control and pain management. So pain is often a time that we see hypnosis being used quite robustly. Childbirth, we see it with chronic pain in the use of hypnosis. And I've collected over 100 different articles, research articles that are pointing in the direction of hypnosis being used in healthcare in this past decade. So areas where we're
Great.
seeing it used outside of pain is GI, gastroenterologists, using it for both IBS and IBD, right? And we know there's a strong stress component to especially IBS, so
Mhm.
hypnosis can help there. Worry, fear, anxiety, depression, cancer, any sort of past trauma. We see it with, we see hypnosis being beneficial for skin disorders or skin problems like eczema, respiratory problems such as asthma, behaviors that people have that they struggle with, such as bedwetting, nail biting. We use hypnosis for bladder training, controlling motor tics, for helping language pathologists in the control of stuttering. And we also see hypnosis being used for sports performance, but we can, and public speaking performance, but we can also use it for medical performance, right? We have somebody who's um, has to go through some medical testing, and hypnosis can help, like calm nerves, reduce that anxiety, helps clients be more resourceful when talking to physicians, asking the right questions. Because some people get really climbed up, then they leave the doctor's office. They're like, I couldn't ask my questions, right? So hypnosis
Mhm.
can really be helpful for that, for kind of the rehearsal part of our mind. Um, so those are, I guess, just the short answer is it's being used a lot. And I think we're also
Mhm.
starting to see the impact of nurses learning hypnotic derived language. And we're seeing that in current studies in 2021 here. We saw it used at the Mayo Clinic Rochester with people in the ICU learning hypnotic derived language to help people who are intubated and sedated. So the language we
Mhm.
use there can greatly impact people's well-being. So yeah.
That's wonderful. I know personally, I used the hypnobirthing with my son's labor, and it just took the fear out of labor. I felt like I was in control of my thoughts, my emotions, and in turn, my pain. So it was really empowering through the whole experience. And my son was my third labor, so I really wish I did it for my first and my second, but that's okay.
Yeah,
And
no,
how,
it's
yeah,
powerful there. And
it's
as a nurse
wonderful.
anesthetist, I worked labor and delivery for a long time. And then
Hmm.
9 years ago and 7 years ago, respectively, I chose to do hypnobirthing for both of my labors, and I actually had
Oh,
both of my
great.
children at home. So talk
Oh, good
about
for
a
you.
huge like deviation, but it just felt like the right thing to do. So
Hmm.
yeah.
That's awesome.
Hmm.
So are people using this for self-care as well?
People are, and I think most people don't realize that they are. So now, I don't
Hmm.
know if we could see the poll results, but how many people have felt like they were hypnotized before versus not hypnotized? I don't know if we have,
Hmm.
if Lisa, if you could tell us
Let
what that
me
ratio
see.
is, or never been hypnotized, 59%. And okay, so we have a good number of people who say they have been hypnotized.
Hmm.
Okay, awesome. So for those people who have never been hypnotized, I want to maybe stretch and expand our awareness of what hypnosis is, going back to that original
Hmm.
definition: a state of consciousness, a state of focusedness, and a state where what we call hypersuggestibility, or what I like to say is suspending our disbelief, right? So those of 59 who say they've never been hypnotized, have you never or ever enjoyed a movie? Like say The Matrix, right?
Hmm.
Or let's just say Superman, because maybe everyone knows Superman. So you're watching Superman and there's somebody in an office and he puts on a cape and jumps off a building, and goes and rescues somebody, right? So if we weren't able to A, be conscious, and B, focus our attention, we wouldn't understand the plot of the movie. But C, we have to also suspend our disbelief. If we were sitting there the whole time and said, this is crumbs, that could never happen, we wouldn't enjoy the movie. Well, so for the sake of enjoying the movie, we're hypnotizing ourselves. We're saying, oh, well, let's just act as if this could happen for sake of enjoying it. So maybe that's a little bit more of a woo example, but have you ever been driving? Because now driving has become something that you can unconsciously do, right? After driving for a while, you don't have to, when we're learning to drive, sure, we got to figure out where our foot is and know where the brake is. And we see the red light and we have to like consciously say, no, pick up your foot, put it on the brake, right? And your parents in the passenger seat were going crazy. But after we learn how to do that, we do it unconsciously. We just get in the car. And instead, we're starting to go through maybe a grocery list, or we're starting to work through something. And all of a sudden, we pass right by that exit we were supposed to be in, right? That's called highway hypnosis, right? If we've ever been absorbed in a book and answered a question and not remembered that we answered that. So then your husband or partner is like, hey, is dinner on the table? You're like, I don't know. Were you going to cook? And he's like, when I came home and you were in that book, you said yes, right? Again, I would say that we're probably in hypnosis a lot more than we think we are. So hypnosis feels really natural. So oftentimes people can be hypnotized and have a feeling of being really absorbed, suspending their disbelief, working through problems, right? While they're driving is all a form meeting those criteria of what is hypnosis. Yeah. So now, now let's redo the question and answer, right? But then when we are going to a hypnotist for specific reasons, and I was a skeptic, I will tell you, I was a skeptic. Yes, I used it for birth, but before I used it for my own birth, I actually used it to get over the grief of a miscarriage. And because of that grief, I was facing kind of a year of having some fertility problems. So when it worked to help with the grief, I actually went back and had another hypnosis session to help with fertility, because I was kind of butting up against age 40. And, they're like, go see the fertility doctor. And all of a sudden I didn't have to do that. So I used it those 2 times. I'm like, well, maybe it could be coincidence, but okay, I'm going to take it, it really helped it made me feel better. And it also got me the result I want. And when I experienced it, I was like, I don't think he really did anything. Yeah, I felt relaxed, but what was happening is unconsciously I was shifting some of those things, maybe even within my own hormone structure of my body, right? Yeah, so pretty powerful.
Thanks for sharing that with us.
Yeah, and your question was, are we using it for self-care? So I would say all of that is self-care, but the other thing that we do know is that when somebody's in that hypnotic state, right? And they're watching Superman and they're kind of into it, or they're into a good book, or they're driving down the highway and doing something consciously and unconsciously at the same time in the active brain state, this dopamine loop is working in their brain. And we know that dopamine loop is linked to motivation, to purpose and drive, right? As well. And so people are using it for goal setting, for feeling happier, for finding their way forward. And it's been an age-old technique to do just that. People would go to sleep temples and have priestesses speak over them to find their way. And now in modern day, we're using hypnosis for business success, for just finding motivation, right? And so people are starting to use it, and sometimes they're calling it mindset work, mindset coaching, or meditation, right? A meditation could be crossing that line of hypnotic as well, when we're using meditation to change, right? To become more positive. So absolutely.
Yeah, so many different ways. Now, thank you so much for sharing that personal story about your journey with hypnosis. Is that where you would say that you became interested in hypnosis and you becoming a hypnotist, or how did you get started?
Yeah, so I will say that my first experience with formal hypnosis, where I, had a hypnotist, and spent an hour with them, having them guide me into hypnosis, that was only about 10 years ago. But if I go
Okay.
back to about 20 years ago, when I finished anesthesiology residency, I was listening to a nurse anesthetist who also was a hypnotist. And his message was about the words that we use in healthcare and how we can be
Mhm.
kind of hypnotizing or dehypnotizing our patients, right?
Mhm.
And in particular, I'll give you just a couple examples so the audience can kind of put their head around this, right? And they're really simple things that he suggested. We want, as nurses, people to be comfortable. So stop calling things this pain pill, right?
Mhm.
Call it this medication will help you feel better, right? Stop asking, are you in pain? And having that pain score. I know we have to put that on our sheet in order to meet the requirement, but what is your comfort level? Um, you know, are you hungry? Right? Instead of are you nauseated? Because we can still get to the same answer. But now we're helping if you think about what I said about change, right? In your mind, if we're asking about pain, we're saying nausea, but we really want their spirit to go that way, right? Not this way, not pain, that way comfort, not this way nausea, that way hunger. So our words can help direct what our patients are thinking. And that thought becomes a feeling, which becomes a response, which becomes a behavior, right? So that's really powerful. So not this way, that way with our words. And that is where like hypnotic derived language can be really powerful, where we can actually add in more placebo effect or belief effect and neutralize the nocebos that we see in healthcare. So we have to be um, bolster up the fact that we give medications that cause side effects. But if
Mhm.
we say, this medication might lead to a severe headache, that's saying this way. But if we say, but if you get that, we can treat it. Now we're having their brain go that way. It's a very different impact on how they feel. So that's
That's
important.
great.
So that's where it really started. And then I have really just geeked out on it since it really worked for me.
Yes.
Right?
I see how this, yes, everyday interaction with nurse patient interaction. I could see how this
Yeah.
could really elevate um,
Mm.
the communication. Now, for people who don't know maybe what a nocebo is, could you just give or tell us what that is?
Oh, sure. That's a great question because I
Yes.
just threw that out there as if it's so obvious. But a nocebo is
Uh-huh.
just the exact opposite of a placebo, right? The
Hmm.
placebo is the positive effect, right? And a nocebo
Okay.
is like the negative effect, right? So a
Okay.
nocebo would be if you take this medication, it may cause, all these negative things, right?
Okay.
Which, like I said, is
Yes.
honestly sometimes in transparency true. And we can
Hmm.
neutralize that by saying, I could cause a headache, but we can treat it, right? So,
Like that. That's great. Thank you. And yeah, so I'm thinking of all these different ways in a hospital or nurse patient interaction. But I know you have a private practice in hypnosis and see
mhm.
clients. How long
Yeah,
do you usually see the clients for a session? And how long does it take to work?
yeah. So that is a very loaded question, right? Um, because um, hypnosis is going to work differently for different things.
Okay.
Okay.
Hmm.
So, and if you think about that, that's so true with any sort of mindset thing, right? If something's really
Yes.
stuck, like if we are using hypnosis for weight loss, right? There's
Hmm.
many layers to losing weight, right? There could be things that are
Right.
really unconscious even to that person. There's secondary gains involved. So I remember when I lost weight and I weighed 130 pounds, like then men were catcalling me and I felt like a sex object. So there's a resistance there that they may not be consciously aware of in that 1/6
Right.
of their brain, right? Because it's deep. So when we're using hypnosis for something that's deeper, anxiety, depression, we're looking at, 6 to 8 sessions. like kind of
Gotcha.
per problem, if we were to put it in a problem category, right? 6 to 8 sessions compared to like if we were doing more of the traditional psychology approach of therapy, we're looking at, and this, I'm not making this up, this was quoted in the research, but you know, we're looking at between 13 and 25 sessions, right? So
Okay.
hypnosis helps it become more quickly. Now, if we're using hypnosis for something like what I call a quit, I want to quit smoking, I want to quit procrastinating, I want to quit eating sugar, right?
Mm-hmm.
2 to 3 sessions, right? Those are
Mm-hmm.
easier. Some people will do them in one big long session, right? But we're talking about like 2 to 3. Make the change, cement the change in, and then help them realize that in the future they have a new pathway, right? We have to kind of create that path because their mind's used to going this way and we're going that way,
Mm-hmm.
right? And then there's some that just take one session, right? We know like uh, some sort of habits like nail biting, bedwetting, um, fears and phobias. I have a fear of snakes, a fear of spiders. That could be one session. Now, I roll hypnosis into coaching. That's where I started to feel like if
Mm-hmm.
I added some more hypnotic language into nurse coaching, my clients were able to get their results faster. So if they had this whole big package, I
Great.
want to feel happier. How many nurse coaches have felt that? You know, their client comes in, I don't know what I want specifically, but they can
Mm-hmm.
list off everything that they don't want, right? That's really easy. I don't want this. I don't want that. I don't want this. I don't want that. And you're like, well, what do you want? They're like, I want to feel better, or I want to be happier, or I want to be more
Mm-hmm.
successful. There's a lot there. We have to first, what is more successful? What is happier? What is more purposeful look like to you? And then
Yes.
they go back to the not list. Well, it's not this, not this, not this, not this, right? Um, but then I would add in hypnosis, and I was like, all of a sudden they could see what they wanted more clearly. They could amp it up. They could get a sense of all of that. So I started using hypnosis there. Yeah. So that was really a big switcheroo for me because I've used language in my nursing career, and then I started to use
Mm-hmm.
it in my nurse coaching. And I was like, whoa, that's really powerful because combined with all the other tools that nurse coaches know,
Yes.
man, that was just like accelerated success. Yeah.
That's awesome. Really
Um,
elevated your nurse coaching. That's great.
yeah. So I don't know if that truly answered your question, but it
No,
really
I think
does
it did.
depend, you know? Yeah.
Yes, yes. And that's expected that it's so individualized that,
Yeah. Yeah.
yeah. And now do you do these virtual or in person?
Oh, yeah, that's a great question. So I
Hmm.
am in a brick and mortar office. So
Oh,
I
great.
do see people in person. However, I also do virtual hypnosis sessions. And just like
Okay.
many things in healthcare that went to the way of telehealth during the pandemic, it was a blessing to have that kind of be an ethical role of practice. So, what we found with the National Guild of Hypnotists and other
Hmm.
national hypnotism organizations is that our hypnosis was as effective, if not more effective, when delivered virtually, right?
Oh, great.
Because nobody's getting stuck in hypnosis. We can do that virtually, and they're in their comfort of their own home. They're more relaxed. So
Hmm.
it's a lot less induction that we have to do because they're already relaxed. So then we can just, you know, go where we need to go. So virtually or in person.
That's
Yeah.
great. So we were just together at the American Holistic Nurses Association
Yeah.
conference, and I was so happy how many nurses attended your session there, and I was so excited to hear how many nurses were coming up to Inca's exhibitor table asking about your new course. So, do you mind telling us a little bit about your new course that's coming up?
Oh, yeah. It's so exciting. It's
It
actually
is.
exciting to see that there's a lot of interest in and how can we make nurse coaching more effective, if that
Hmm.
were people to choose sustainability in our nursing profession, right?
Hmm.
And so hypnosis can help you as the healer as well as our patients. So I think it's fabulous, and this course
Yeah.
is designed to just do that. It's designed to take you on a journey of experiencing hypnosis, all different levels and types of hypnosis, because hypnosis is a tool and there's many different ways that you can use the tool. So we unpack many of those ways in the 12 weeks. So part one of this hypnosis course is 12 weeks long. And each week we learn a different segment of hypnosis or something that I'm gonna throw another acronym out there, but I know you can handle it because you're all in healthcare, and it's called NLP. And it was in my introduction, right? So NLP, you might be like, what is that? Neuro linguistic programming. It was kind of born in the 1980s. So hypnosis is ancient old, right? We know hypnosis from Plato and Socrates talking about the mind-body connection, right? But in 1980s, what we had is we had a fantastic hypnotist called Dr. Milton Erickson, who used hypnotic language. And in 1980s, Bandler and Grinder started studying people who were getting these excellent results in therapy. And that was the birth of neurolinguistic programming. So neurolinguistic programming is neuro, our neurology, linguistic, our words, and then program is kind of our operating system, or like, how does that impact people, right? Our beliefs, our values, our operating system, how we're moving forward in life, our purpose, our drive, all that. So neurolinguistic programming, and for those of you who are just listening to the audio, I'm kind of making this symbol with my hand, like there's these two circles, right? There's hypnosis and NLP, and make that into a Venn diagram where you have both circles, and the overlap in the middle is the juice. That's where hypnosis and NLP come together. So in that first 12 weeks, it's not just the classic hypnosis that I untether for you. It's also some of this neurolinguistic programming, because when we know language skills, we can do hypnosis in our conversations. So when we learn NLP and we uncover the language skills that these great hypnotists had, we can then use it in our conversations, right? And that's the amazing part. We can hear what our clients are saying differently, and we can respond back into their model of the world. So in nursing, it's sometimes called modeling and role modeling. Actually, that was Dr. Milton Erickson's daughter and granddaughter who authored that book, right? Oh, wow. So they learned from the master, and NLP is also from the master, one of the masters himself, the great Dr. Milton Erickson. And so we spend time learning hypnosis and NLP in that first 12 weeks. It's online for 9 of those weeks. And then in the 3 weeks that it's not, on your own pace, we get together in a Zoom room for 2 hours and practice with each other. So it's peer-to-peer practice alongside master hypnotist and NLP practitioner to give you some feedback. So we get to experience that. And then if people are really wanting to go all in and say, I want to be a professional hypnotist as well, and that would be really cool to add on to my nursing career, we go on to part 2. And part 2 is after part 1, but it doesn't have to be taken right away. So you can take part 1 and then pause for a while, come back and take part 2. And part 2 is 100% with me for 64 hours. So we have to hit that 100-hour mark in order to qualify for being called a consulting hypnotist, right, by the National Guild of Hypnotism. But I take I can't really do the math right now, 30 something hours from part 1 and apply it to part 2. So then we spend 8 days together in practice. You get the whole programs on how to do smoking cessation, weight loss, stress management, as well as how to not just experience self-hypnosis, but how to teach a self-hypnosis course with part 2. And all of those scripts and everything is built in, how to start your own business or side practice already built in there. So yeah, that's what that looks like. And so that's really awesome. Exciting, because I'm like, yes, man, I wish something were offered like that when I was learning this. I would have loved to learn from a nurse, because they know the lingo and they know how to apply it to real life nursing situations, which is really cool. And the language part is actually absent from a lot of hypnosis programs. They just teach you how to do the kind of 20-minute, relax your body, and then they do the change work. But what if you wanted to just do it with conversation? So that's why when I was thinking about nurse coaching, it had to be both. It had to be NLP and hypnosis, so we could just really know how to do that in all areas of everything that we do. So
great. It's tailored for nurses. I love that.
I know. So excited.
And this starts next month, correct?
Yes. Yes.
Cohort 1. Awesome.
Cohort 1 starts the week of health and happiness with hypnosis. The national day is actually happens that week. So what a
Oh,
coincidence.
wow.
Yeah,
Perfect. It's meant to be.
meant to be.
Now, would you be able to lead us through an experience of hypnosis while we're on with you?
I will, because one thing I did notice is that we didn't do our kind of centering practice. So let's do that
Yes, in the
now. And
beginning.
we'll do it
Sounds
with a
good.
little bit of a hypnotic twist. And this will be, for the general good of all of us. So we'll
Okay.
just do a little change. Hypnosis is about change with coming into touch with our inner self. Okay.
Okay.
So hypnosis can be enjoyed with your eyes open or with them closed. So I invite you to, if it's safe for you to do so, please know that we're going to enjoy a hypnotic experience. So you should not be doing anything that requires your full attention right now. But if it's safe for you to do so, you can just allow your eyes to close. And taking a deep breath in helps create that bridge between the conscious mind, the one that's analytical and thinking all day, and that unconscious mind, our mind body connecting us. So deep breath in and out. You're already pros. You know how to do this so well. So as you notice that deep breath in and out, if your eyes have been closed, I want you to just notice that relaxation that's in your eyes right now. And I want you to magnify and intensify that relaxation. We're just going for a sense of relaxation in those eyelids and how good it feels to have them closed down. And take that relaxation and allow it to come up over your head and go down over the entire body from the top of your head all the way down to the tips of your toes. Soothing, comforting, gentle, familiar relaxation. Good. Notice any areas of tension in your body that need a little more relaxation. Just say hello and relax. And bring your awareness back to your eyes. And notice how relaxed your eyelids feel, nice and closed. Good. And take that relaxation now and allow it to go down once again from the top of your head, melting as if the warm sun is just melting the most delicious golden honey into every cell of your body from the top of your head all the way down to the soles of your feet. Want that relaxation to happen, make it happen, it will happen. Melting, soothing, comforting relaxation familiar to you. Feels so good to relax the tension out of each and every muscle of your body as you bring awareness back up to your eyes and notice how much more comfortable and relaxed your eyes are right now. And notice also how much slower and deeper your breathing is. That's right. Good. Now, as you bring your attention there, once again, as if you could just bring your attention to right behind your eyes as you're sitting on a little yoga pillow behind your eyes, controlling every thought and just allowing everything to soften and slow down. That's right. So now as you allow this trance-like state, this hypnotic state, this feeling of just being relaxed and fully in control to take over, I want you to allow that to deepen even more. And I wonder how much more comfortable and tranquil you'll be and how you can really become more comfortable. Aware now perhaps of that pleasant heaviness in your arms or legs or your whole body that just seems to be there. But then perhaps it is off somewhere away from here. There in that chair, resting comfortably, while that conscious mind continues to drift and allow the unconscious more and more of the responsibility for allowing awareness of just how little you need to concern yourself about the things that are of little moment. Bringing that awareness to your eyes and just allowing that relaxation to feel as if we just put a little bit of glue on the inside of your eyes and sealed them shut, and they're sealed tight as a sealed drum. And you can try to open your eyes, and every attempt to try to open your eyes will just send another wave of relaxation throughout your body. So go ahead and try to open those eyes, and you'll find that they want to stay closed, and they'll send another wave of relaxation through your body. That's right. Just try to open your eyes, and you'll find they're so relaxed, they want to stay closed, sending another wave of relaxation through your body. and quit trying to open your eyes and just stay there. It can happen if you wish that your unconscious mind can allow you an opportunity right now to experience those things which are pleasant and positive, to surprise you perhaps with a pleasant thought. A long forgotten memory of a happy event, even a taste or a fragrance, something that you really enjoy, a warm and all-embracing feeling of being at one with yourself, a brilliant color that will suddenly evoke that feeling, a memory, a thought, that pleasant experience of how wonderful it is to be alive, to experience these moments that really do stand out for you, each and every moment that stands out, wonderful times of pleasant experience. And you can know that you really do not need to know just how your unconscious mind knows how to do that for you in that way. Simply take this moment, take that moment, and bask in the light of relaxation, in revelation, as your unconscious mind just opens up. Feel it become more expansive, allowing that inner voice of yours to become just slightly louder, that inner voice, that creative and unique part of you, to give you that gift, that feeling that will allow you to understand even more. Even more. There you go. Good. And when you are process whatever you want to find, experience, or enjoy right now, only as quickly or as slowly as you need to, you can just allow yourself to come right back to the room at your own pace and in your own time. Now, as you come back, I just want to ask you a question. I asked you if you could just try to open your eyes and see if that relaxation could just hold them shut. So when you tried to open your eyes, did you feel that wave of relaxation come in even deeper? But you probably knew that if you wanted to, you could open your eyes. But you chose to keep your eyes closed and invite that experience in. And if that was the case, that was intentional, to let you know that you always have a choice. We always have a choice in hypnosis, because it's not mind control. And you just proved it to yourself because you kept your eyes closed and you made that choice. So welcome back. Did you get in touch with your inner self? And what did it say? What did you find, and what positive memories were there? And all of that is not for me to know, but for you to recognize that you were in that 5/6 of your mind that we call the unconscious mind, or some people call it the subconscious mind, but we were unaware of it until we went down in there and found what we'd like to have and brought it back up. So there you go. I hope you enjoyed that.
Thank you. Thank you
Yeah.
so much. That was very enjoyable and very relaxing. I don't know if I can go on hosting this webinar.
Oh, I
Thank
know.
you.
It's hard to come back, right? Yeah.
I know. So relaxed.
Yeah.
So we'll see if anybody has any questions. And if you do, you can put it in the Q&A in the bottom. But if Lisa, if you want to come back with us.
Hi, thank you. And thank you for the rescue, Christy, regarding the mindfulness myth, and your practice helped me release my remorse for that. So thank you.
Oh, good. See, it was all meant to be. And
yeah, exactly. When I was settled in, I was like, oh, this is fine. This is fine.
So the nice thing is you can see the parallel between, a mindfulness practice, right?
Mm-hmm.
And hypnosis. So it's going to feel really familiar to those of us who are nurse coaches and are used to experiencing that. And then it's kind of just the driving after that, where the language becomes a little bit more, you have to be aware of that. But yeah. So.
Yeah, very true. So I have a couple questions to ask. What is the date of when your course begins? You said next month, but
yeah. I'm looking, it starts, I think it opens July 24th.
Okay,
is when we'll start online. Yeah. And
Nice.
then we'll
And
meet in person. And those weeks that we meet in person, I'm always offering 2 times to meet. So if you can't meet
Nice.
the first evening time, then I think there's also a Saturday morning option. So depending on where in the world everyone is, hopefully you can make one of those practice sessions because it's really crucial to kind of be able to experience that. Yeah.
that's a great idea. Yeah, offering the two, because with the shifts in time zones.
Mm-hmm.
Um,
Mhm.
and then so if this is being offered, and students when they graduate they want to come out of the program and use it in the hospital, what
Mm-hmm.
would that look like for a nurse? Like, is that in our scope of practice? Is that
Yeah.
like a separate consent that's needed? Like, how would
Mm-hmm.
that in like the hospital setting or clinic setting?
Yeah, that's a great question. So one of the books that we're going to get into in the first part one is actually called Patient Sedation Without Medication. Yeah. So it's definitely hospital based. So it was written by a radiologist who was using hypnosis in procedure room and teaches hypnosis to medical professionals in the hospital space, right? So if you're doing a practice like what I just did, where you're guiding somebody, sometimes hospitals will call that guided imagery, or
Mm-hmm.
sometimes they'll call it what it is, hypnosis. So oftentimes they will have a consent form for the patient. Um, and the other part of the course is just using our language to guide us, right? Using our language that we've been using since we could talk. And so if you're just using language and conversation, then you wouldn't need a consent form. Yeah. So
Perfect.
that's kind of the difference. Hypnosis is not illegal in any of our 50 states in the United States, um, but it's not generally covered by a person's insurance plan. So generally, we'll hear the term guided imagery, right? So we talk about some of those logistics in part one. So hopefully that
Perfect.
helps.
Yeah,
Um,
no, it really
yeah.
does. Thank you.
Mhm.
Couple more. What is the distinction between hypnotist and hypnotherapist, and which would complete both parts of, and which would those who complete both parts of this course be considered? So would they be a hypnotist
Yeah.
or a hypnotherapist?
Yeah, so it was not very long ago that as a nurse, as a licensed professional, you could use the term hypnotherapist. Yeah. However, and the initials would be CH, clinic,
Mm-hmm.
cert, consulting
It's okay.
hypnotherapist, right? Um, However, since 2021-ish, so not in very recent times, they've converted to just calling it hypnotist because
Okay.
therapy kind of has this link to
Mm-hmm.
psychotherapy, mental health counseling. So you would become a consulting hypnotist, um, and that would be the credential that you would be offered after part two. Mhm.
Perfect. Thank you. And will students be able to hypnotize themselves?
Yes, self hypnosis is part of actually part one. So we'll learn self hypnosis in part one, and then you learn how to teach self hypnosis in part two, right? Because I do think that if you're going to spend the time, the 12 weeks with me, I'd do you a huge disservice if I did not teach you self hypnosis. Um, and because then if you're a meditator, if you're a journaler, I mean, just you can get into a hypnotic state very quickly. You can learn to, change your habits, to increase your motivation, to find your purpose and
Mhm.
drive. And we'll learn how to do that in part one. So self hypnosis is a key part of any hypnosis experience.
Perfect. Thank you. And then Nicole is asking, she read that using hypnosis to aid in the treatment of phobias, anxiety, and depression can only be done by a licensed professional. What is the implications there for nurse hypnotists when who complete the program?
Yeah, so you would be a certified hypnotist. So you could uh, offer those services. If it is for a medical condition where the person is seeing a provider for that, I always just get you know, a referral for hypnosis for that. Hypnosis would be contraindicated for patients who are already in an altered state of consciousness. So people who are experiencing hallucinations due to a mental or a organic brain problem. But outside of that, you'll learn how to do hypnosis for pain management. But if you're working with somebody for pain, I just say, even if you're a nurse, just bring their doctor on board. I've not had a doctor yet that has said no. And every time I just go ahead and say, here's the referral, just let them know that you're going to do an alternative therapy, a complementary therapy, hypnosis, and that I am a certified hypnotist. I've never had anyone say no, and it's only resulted in more referrals. So part of that is absolutely true, and that's how I would ethically coach any nurse or any hypnotist for that matter to work in collaboration with a provider if the person is seeing a provider for that problem.
Wonderful. And then just a little kind of like kudos, I guess, to you. After listening to your podcast, I was still working in the PACU at that time, and the shift in language really hit me, because what do we ask in the PACU? Are you having pain? Are you nauseous? And so I started shifting it, and then slowly but surely my coworkers were shifting it too, and we really did see a change and a difference in that, because we were, especially when they're coming out of this state of anesthesia, and now we're like, are you in pain? So I really loved that. Betsy has a question here. I've heard mixed things about hypnosis as a contraindication with seizure disorders. Do you have any insight on this matter? And she also says, thank you so much. This is wonderful.
Yeah, great question. I would, if somebody was epileptic or had seizures that they were experiencing, kind of just like we do preoperative interviews for patients, and we're going to give them a hypnotic anesthetic, right? We want to know, are your seizures well controlled, or are you experiencing them often? Some hypnotists will do kind of light and sound therapy alongside, just using their own voice. And that can be very triggering for people that might have a seizure condition, right? So, we're going to use our judgment. And again, if somebody's being medically treated, and especially if they're coming to you to help reduce seizures, I just work with their neurologist or whoever is their prescriber for that condition alongside them. So
does it matter if they're on their?
Betsy.
Yeah, does it matter? I'm curious too. Does it matter if they're on medication? No, you're still, yeah. Okay, cool.
Yep.
Yeah.
And I think, just what you experienced just now, helping somebody get into a relaxed state, right, where is generally not going to elicit any triggering signs of seizure. If anything, it's going to lower that seizure threshold, or increase that seizure threshold, so they're less likely to, because we're putting them in a parasympathetic nervous system state. But again, when in doubt, I always defer to their primary provider and work alongside of them for that.
Thank you. We have a couple more minutes left. If anyone has any final questions that you want to ask, I'm excited for your program, Christy.
Thank you. And I know that we asked another poll question about if you had a specific food that you really wanted to stop eating. Right. And I think we gave the example of Hershey bar, and we're actually going to do a demonstration here of that, that technique. Look, okay, so there's like 29% of people who said yes, that they have a specific food that they'd like to not like anymore. The reason I was going to use that as a demonstration, because in about 7 minutes, we can use hypnotic language skills to eliminate that food from their liking selection pattern. And so that's a demonstration that I'll often do. And if you're in part 1, I've recorded some of those before, and you can see them in part 1, some of the recorded demonstrations. But that has been a tool that I've had nurse coaches come back, and they're like, I was listening to do that demonstration, and I just tried it on myself, and I haven't eaten those Chips Ahoy cookies for like 6 months now, right? So think of the power, especially if you're working with a diabetic client. who has this one thing that they are always eating, or you're working with somebody who wants to lose weight and they just, they'll find themselves like with Ben and Jerry's, like just shamefully like eating in the car before they get home so nobody knows they're eating it. And you could just do a really quick technique, and then all of a sudden the next time they go to eat that, they're like, oh, I don't really want that, right? So that is a perfect example of your mind is going this way. You have a habit and we say not this way, that way, and we do it in 7 minutes, like eyes open, and it's a great technique. So I'm sorry we couldn't necessarily do it here. We're not set up where there's, a lot of screens, and we ran out of time, but that is a really great way to use hypnosis, and change can happen quickly as long as and we're doing it all ethically. The client wants to not like this food, right? We're not going around being like, you're not going to like Cheetos anymore, right? But truly, like if they're like, I can't stop this, right? We just put them on a different track. And that's a really cool demonstration to know and to watch. So
Perfect.
yeah.
Thank
So
you.
I apologize that we didn't get to that. It was a little teaser, but that's why it was there. Just so you weren't like, what is that question all about, right? I felt like I had to explain that. I think I have a high need for closure or something, right?
Oh yeah, I see. Yeah.
Yeah.
Well, thank you. A couple of I don't want to keep people over, but Deetra had a question. She trained with someone else for NLP and hypnosis. Can it be considered?
Well, every trainer does things a little bit differently. So I would like hop on board, and you're always going to bring something more to the class. If you already know NLP or hypnosis. So I would say do that.
Okay. And one last one, what is the current demand for hypnosis outside of the hospital setting?
The current demand is there's a mental health crisis and people are looking for help, right? They just want to feel better. And a lot of everyday things can be cured with everyday hypnosis, and they don't require the skills of our psychotherapists or mental health providers. So in my community and all the communities I'm connected with, they're grateful to have another hypnotist or somebody who knows that, because then they can say, you know what, you're totally safe to do this, and they kind of will send clients to me. So there is a demand, and I think people are searching for the word hypnosis now because there's more and more research happening with functional MRI proof, with PET scan proof, with all of like Dr. David Siegel's work in Stanford about hypnosis. We're hearing it on podcasts, so patients are starting to search for it. So wonderful. Outside of the hospital setting. So
great.
The great question. Thank you for that.
All right. Well, thank you to all the listeners for meeting with us, and a big thank you, Christy. It's really nice to see you again, always. And I think it's safe to say we're all very excited for your program to start. Yeah. So please go to inursecoach.com if you have any more questions about the program. There's a lot of FAQs that are answered there. So, and then you can also reach out and speak to someone and administration if you have any more questions. Yeah. Follow us on Instagram, Facebook, LinkedIn, Twitter, and YouTube, and always feel free to reach out with any questions that you may think of. Thanks for gathering with us, and we will see you all on July 20th for our next webinar. Thank you, everyone.
Thank you.
Thanks.